everybody for coming in and listening in on our session. This is going to be Faster Miracles, Blockchain Applications and Medical Research. So it's basically, when people hear about blockchain, they think about cryptocurrency and Bitcoin. There's a lot more than that, right? So we wanted to put this session together to talk about how blockchain is the future and how it's impacting us in the medical field. So with that, I'm gonna hand the mic off to our lovely moderator for the day, Tiffany Gray.
Good afternoon, everyone. Thank you for joining us for this afternoon's session. My name is Dr. Tiffany Gray. I am a fellow with Blockchain and Healthcare Global. I am also co-chair of the Global Health and Disaster Relief Subcommittee as part of the UN's Blockchain for Impact initiative. And in addition, I'm a research and science advisor with a blockchain think tank, Axes and Eggs, here in Washington, D.C. I have a background in public health research, and so my mission and purpose and love is helping others. And so I really hope you enjoy our discussion here today. And to get us started, I'm going to have our lovely panelists joining us this afternoon start off with some introductions.
Good afternoon. My name is Oki Mek. I am the Chief Product Officer for Division of Acquisition within HSS. We are actually going to be going live with our blockchain network. We'll be the first one in the federal government that's been ATO. Jose Arrieta has been promising Thanksgiving, but it's around that time. It's a long process. We are going through it. Hopefully from today, my specialty is cybersecurity, IT, and acquisition, but hopefully that I could explain it well enough from a blockchain perspective that you could use for your use case, because it could be used in other areas as well. I think the biggest area that will have the biggest impact is cybersecurity. I think cybersecurity will have, blockchain will have the biggest impact in cybersecurity than any field, including HR, acquisition, IT, anything. I think cybersecurity is the key to blockchain. Thank you.
I'm Tim Gilday with General Dynamics Information Technology. We're a strategic integrator, largely focused on the federal government, some state and local work. That means we don't have necessarily armies of engineers inventing technology, but we do have some in-house experts. Our job is more to be aware of the best and brightest technology vendors out there, make sure that we're partnering with them, and work with the government to pull the correct players at the right time for the tailored solutions that each of our government customers needs. My background, to be honest, I came from an IT service management, process-oriented project management background, and only for the past couple of years have I been in blockchain technology. Just took over emerging technology at General Dynamics.
Thank you. My name is Sean Manion. I am a neuroscientist by training, and for about a decade I was a federal research administrator with the Defense and Veterans Brain Injury Center, which was the traumatic brain injury network for the DoD. About 2 years ago, Health and Human Services Office of the National Coordinator, a woman named Debbie Bucci started this effort, held a white paper contest for what blockchain technology could be used for in healthcare and in health research. And in reading the winners of, the 15 winners of that, and even some of the ones that weren't selected, it really opened my eyes to what the technology could do for advancing not just healthcare generally, but specifically the areas of research that I was involved in. I saw a lot of the pain points that crossed the research network that we had, data sharing, data usage, publications, a number of things that this technology could improve in a lot of different ways, but I knew it was still very early. I left to start a small company, a little pre-seed startup called Science Distributed, which is looking to bring scientists together in a de-siloed way with this technology as a mechanism of trust. And I also am a co-founder of the Blockchain and Healthcare Global that Dr. Gray mentioned, which is a 501c6 under the IEEE International Standards and Trade Organization, intended to help bring industry together across healthcare and health research to really start to set standards for how this technology can be utilized. That's me. Tiffany, did you want me to give any further background on the tech, or?